Hello, folks. I am the Old Sergeant. The Wuhan coronavirus will continue to be a worldwide threat for some time to come, perhaps years. Here are some of the information I have consolidated. It includes plausible explanations, theories, and reports. As we cannot trust the Chinese government, we can only go with the best open source intelligence we have at the moment. Where did it come from? First indications are the virus came from open-air meat markets that sell exotic meat, even bat meat. As the area of the outbreak is also where there is a biolaboratory that studies such viruses, there's a very high possibility it is a lab release. China is well known for corruption. Poor construction of the biolab may have resulted in the lab not having the containment capabilities it is supposed to. A lab technician not following protocol could have gotten themselves contaminated, then going out in public spreading the coronavirus. A low-level employee with the responsibility of taking and incinerating test animals may have taken the animals to the local street meat markets to make a few extra yuan. The actual cause will probably never be known to a high degree of certainty, but we know this is where it started. Why was the response so slow? Flu-like symptoms is thought to be the flu. High flu casualty rates would alarm most nations, but is within the normal range for the high Chinese population. Chinese and communist cultural tendencies would make a doctor that realizes they are dealing with something new very reluctant to report it. In the mindset of the government and local management, you report a problem, you are the problem. No one can take initiative without senior governmental approval. This takes a lot of time, and the senior governmental official does not know anything and is only interested in covering his butt. Why is the Wuhan coronavirus so dangerous? It's durable, it's airborne, and it's highly transmissible. Right now, it has a 2.2 to 2.5 fatality rate. Infectious, while the host does not show any symptoms for up to 14 days. Lower mortality rate, higher infection rate than SARS. Limited medical resources. Once the bed space and medication were used up, there is nothing that can be done for the tens of thousands of patients. Hygiene, sanitation, and general cleanliness is bad in densely populated China. As the virus is a probable lab release, it may have been designed as a bioweapon. That would make the coronavirus purposely designed to spread easily, difficult to diagnose, difficult to treat, and deadly. Some bullet points. February 3rd, 2020, Johns Hopkins Center for System Science and Engineering data has 17,485 confirmed cases, 362 fatalities, 518 recovered. Even if the Chinese government was not trying to suppress the actual numbers, accurate numbers may be impossible to get. World Health Organization declares a global health emergency. Virus is mainly fatal to elderly and sick. Numerous countries have closed borders and/or flights in and out of China. People on flights in from China, such as nations bring their citizens home from China, are being quarantined. Advanced countries may have the capability to prevent the coronavirus from spreading widely. Advanced countries have modern medical care for victims. Advanced countries have healthy populations more capable of fending off viruses. Unconfirmed but very plausible reports. China is arresting people critical of the Chinese government response. Not surprising. The Chinese government is ordering the culling of pets, fearing the virus can be transferred to pets and from them back to people. Chinese government is blocking social media reports. Many Wuhan coronavirus deaths in China are being attributed to other causes to keep the fatality rates down. Reports of people trying to escape China being shot. Funeral homes do not have enough vehicles. Bodies not being tested, just cremated. Mask shortages and masks being taken out of the garbage and reconditioned. Current primary fears. If the virus spreads to India, there could be a high death count in that country. The virus mutates into a more dangerous form. Economic catastrophe due to isolation of China and its manufacturing output and not being able to ship out its products to the world. Factories are closed. My perspective. For us in the West, we can feel optimistic that our ability to quarantine and provide medical care to anyone within our country. You should already have emergency supplies. If it is necessary for you to hunker down in place because of a blizzard, social uprising, or viruses, you should be ready. Simple precautions such as washing your hands frequently is very important for hygiene. The West's high hygiene level is another preventative. My main worry is the worldwide economic crash that could be caused by China being walled off. I am the old sergeant. Stay active, stay prepared, stay vigilant.